Word on Health, the report with its finger on the pulse of popular medicine with Paul Pennington. Word on Health, for your very best of health. Thanks to the award-winning performance of Peter Ash as Paul Foreman, a character with the terminal condition motor neurone disease, or MND as it's otherwise known, on the ITV soap Coronation Street, and the magnificent, dignified and selfless efforts of the late great Leeds Rhino rugby player Rob Burrows and Scottish rugby legend Dodie Weir, who both sadly lost their lives to MND, public understanding and support for motor neurone disease has increased significantly. Jo Mountney from the MND Association explains why raising awareness is so crucial.
The more people that know about MND and to understand it and see the devastation that it has, the better, to support us as an association, to raise funds for us so that we can invest it into the research. And only then can we really affect the change that's so desperately needed and that we're working towards every day. We know, as you've mentioned, Rob and the likes of Dodie Weir, who were really brave and opened up their homes and their lives for people to see what it's like for people living with motor neurone disease, because there wasn't much awareness of it before, to look for the signs of what motor neurone disease might look like if people start experiencing any symptoms that could be related.
So let's address that stage by stage. As we've come to know, MND is a rare progressive disease that damages the nerves and muscles in the brain and spinal cord. How might it manifest itself initially?
The difficulty is it really affects everyone differently. My father-in-law was diagnosed with MND in 2018, and his first symptom was starting to lose the use of his right arm. So muscle weakness is definitely a sign. I've met people at support groups that have just lost the use of part of their thumb. So it's not always big muscles that go, but muscle weakness is definitely one of those. There can be muscle cramps or spasms as well. And then speech and communication problems. So sometimes it starts affecting the way that you speak, or swallowing difficulties as well. So those are some of the common symptoms that you would probably only get one of at the start.
I guess because these symptoms can be quite vague to start with, that makes it difficult for doctors to diagnose.
It is. And it's also difficult for doctors to diagnose because there's only around 5,000 people in the UK at any time living with motor neurone disease. So it could be that, a GP has never come across a patient with MND before. So the diagnosis stage can take quite a long time, which in itself causes a challenge given how quickly the disease can progress with people.
I understand it can affect people of all ages, but it's more common in people over the age of 40. Are there factors that place a person at a heightened risk?
Not proven at the moment. We think that there are some environmental and lifestyle factors that could act together with specific genes to predispose people to get MND, but at the moment we don't know what the exact recipe of those factors are.
How does MND progress and what challenges do patients and families face?
It really varies from person to person. In most, it's quite rapid. For others, if you think of Professor Stephen Hawking, it can take a lot longer. I think when we first started doing the research after my father-in-law was diagnosed, the scariest thought was that his mind and his eyes were potentially the only things that were going to remain active, and he could almost become trapped in his body that would no longer work. And, he'd been a very active man. He was a mounted policeman. He enjoyed fishing. He'd played rugby when he was younger. To think that he may get to the point where he was just going to be in a wheelchair with only his mind and eyes active, that was really a scary point for the family.
Are there any treatments that might slow the progression?
There aren't for the majority at the moment. And again, that's something that we're working really hard in terms of research. There is one treatment that is proven to be effective in about 2% of people that are living with MND with a specific gene. And we're currently working with NICE to work on getting that drug available to those people with that gene.
Looking to the future, is there a pipeline of treatments that offer hope?
We're certainly hopeful, and we've made more advances in the last 20 years than we have ever done before. At the end of December 2024, we had a research grants portfolio which consisted of 133 grants with a total value of just over £24 million involving 290 researchers. So the more money we can invest into the research and get the experts looking into it, then hopefully the sooner we can find treatment and ultimately a cure.
The MND Association offer an extensive range of help and support services for both patients and families, including grants to assist with the cost of living, through to the campaigning work you do to ensure patient needs are at the front of mind of those that can make a difference, and of course the research you spoke about towards finding treatments and a cure, only made possible by the incredible generosity of donations from the public.
It is, and it's been phenomenal to see the impact that the likes of our late patron Rob had on that and the awareness. My father-in-law was diagnosed in 2018, and I think Rob started sharing his story in around 2019, 2020, and just the awareness of motor neurone disease and then the Coronation Street storyline has just had such an impact around the amount of people that know about it and the amount of people who do amazing things to help us raise money towards all of that really important research and support that we can give to people with MND.
My grateful thanks to Jo Mountney from the MND Association. To link through to the charity, visit the links page of the wordonhealth.com website. That's wordonhealth.com.
Word on Health, for your very best of health.
Campaigners are urging women who plan to be pregnant or who are in the early stages of pregnancy to ensure they're getting the correct daily dose of folic acid that is crucial to the development of healthy fetuses and reduces the likelihood of developing neural tube defects that affects around 1 in every 1,000 pregnancies, which, if the baby does survive, can create lifelong problems for the child, as GP and medical journalist Dr. Rob Hicks explains.
The one that everybody recognises is spina bifida. And what is problematic with this condition is it leaves the child with problems with their spine. It might be with their mobility, with their bowel and bladder control, with more challenges than one would hope that a child would have to face in their life.
Rob, in a measure aimed to prevent around 200 cases of neural tube defects every year, the UK government has called for folic acid to be added to non-wholemeal flour from the end of 2026. But of course, that is some way away. I understand that under the Healthy Start scheme, all pregnant women are entitled to free vitamin supplements, including folic acid. Can't women get enough of it from a healthy diet?
We can get folic acid from the diet, but not enough. Simply taking a daily dose of folic acid can significantly reduce the number of pregnancies being affected by neural tube defect by around 72%.
So how much folic acid should be taken?
We recommend that women take 400 micrograms of folic acid every day, not just during the first 12 weeks of pregnancy, but actually from a few months before they even start to try and fall pregnant. And the reason for this is to make sure that they get the levels of folic acid in their body ready, and also because many women fall pregnant really quite quickly after starting to try. For many it takes months, but some fall pretty much immediately. So you need to have those levels of folic acid there ready.
I understand there are instances where a midwife or a GP may ask a woman to take a larger amount of folic acid.
For some women, they need to take 5 milligrams per day, and this is if they're in a high-risk group who've had a previous pregnancy affected by neural tube defect, if the woman or her partner has a spinal cord defect, if the woman is taking a medication for epilepsy, or if she has a condition like celiac disease or diabetes. So it is important that a woman checks with her doctor which is the appropriate dose for her to take.
My grateful thanks to GP and medical journalist Dr. Rob Hicks. To find out more, visit our website, wordonhealth.com. That's wordonhealth.com.
Word on Health, for your very best of health.
The annual Rare Disease Day initiative raises awareness and looks to generate change for those living with a rare disease, their families and carers. A disease is categorised as being rare when it affects less than 1 in 2,000 people. Across the UK, there are over 7,000 rare diseases. One such thankfully rare condition is Dravet Syndrome, something that the 13-year-old son of Dravet Syndrome UK's trustee, Stephanie Smith, lives with.
Dravet syndrome is a rare and complex epilepsy. It occurs in around 1 in 15,000 births in the UK, as well as seizures, which can be very frequent, they can be very severe and very unpredictable and very complex. What you also see is it's a condition that brings a whole host of neurological conditions together, which can be intellectual disability, problems with movement, speech, autism, ADHD, challenging behaviours and learning delays, sleeping, eating, eating, lots of things that really impact on everyday life. And it doesn't just impact on the patient, it impacts on everybody that's involved with that person, the family, siblings, parents, everybody.
I understand it usually starts in the first year of life, often around 6 months. Babies usually show normal development before they start getting seizures associated with Dravet syndrome. Do we know what causes it?
It's a genetic epilepsy caused in around 90% of the cases by a mutation in a gene known as SCN1A, which is a gene of the sodium channel. The movement of sodium ions in and out of nerve cells help to control electrical messages in the brain, and a faulty ion channel gene causes seizures and the spectrum of conditions that you then see in Dravet syndrome. And in around 90% of cases, Dravet gene mutation is something called de novo, which means that it happens spontaneously and it's not inherited from parent. It's a clinical diagnosis, so it's also based on symptoms. So consultants that are becoming more educated and aware of the condition may then go on to do a genetics test, and it's a really important thing to do because that is what then confirms the diagnosis.
I know it took some time from his initial seizure at 5 months old for your son to get the diagnosis. As a parent myself, I can't imagine how you coped hearing that news.
You go through a grief process. It is grief, and you learn that as you sort of live with the condition. And we both grieved at different stages, and it was sheer panic to begin with of how am I going to keep him alive? How am I going to be able to function as a parent in a permanent, constant state of fear, which is how I felt the first few weeks, this fear of him dying, and I didn't sleep, and I was watching him sleep and, watching him all the time. For my husband, in the moment, he handled it quite well. But then actually, as the weeks and the months went by, he began to grieve for, I think, the son he sort of thought he was going to have. He grieved about the fact that would he ever ride a bicycle? Would he ever, go off and play independently? Will he ever get married? Would he ever do all of these things, which as a parent, you think about them doing? And it was a really sort of rough time. And we wanted to sort of reach out and get support, but we also didn't. We didn't want to learn more. We didn't want to be told worse things. And we sort of went on the forums and went on things and actually got some really scary statistics. And it frightened us. So we stepped back a bit, and then we realised that actually we weren't doing a service to Jake. We needed to learn everything we possibly could so that with the knowledge we could help him. And that's at that point when we got in touch with Dravet Syndrome UK, who then began this process of arming us with all this information and giving us support from practical, emotional, financial. And we went on this journey with them holding our hand. You're instantly with people that understand. You don't feel alone because your friends can sympathise. They'll never ever understand what it feels like. But when you are surrounded by people that get you and that are going through the same things as you suddenly don't feel quite so alone or so scared, and you can support each other. And the charity do so much from a practical point of view. So from years of us not sleeping and standing over him, funding a saturations monitor so that we would be alerted if he got into breathing difficulties at night, funding us with grants, letter templates when you are battling school, teaching you about the perilous journey of the educational healthcare plan system or direct payments, social workers, community nurses. Educating you is what the charity can do. All those really, really sort of pivotal things.
There is currently no cure for the condition, and Dravet syndrome has proved to be in the past one of the most treatment-resistant spectrum conditions. I read about the potential of gene therapy and new treatments in the pipeline. Where are things at with that?
It is such an exciting time actually to be involved because until recently there were really few medications available for Dravet syndrome. We are at a point where there's new things on the horizon, and that's down to these amazing, incredible medical professionals that are researching. There's been recently 2 new anti-seizure medications, and they've become available. What you tend to see is what works in one won't work for another, or it could cause other problems. It's very unpredictable, but it's looking at medications that don't just address the seizures. They've got to address everything else that goes with it, the learning delays, the behaviour, the gait, all of that. But also, there is so much exciting things. There is potentially a disease-modifying gene therapies. So they're entering, I think, phase 3 clinical trials this year, which are just absolutely incredible, and I'm really excited for our next conference this November to actually go and hear from all these incredible scientists and doctors about where they're up to with these gene therapies. And more anti-seizure treatments are coming through on the horizon too. So there's so much going on, and there is hope. There's hope for the future. There's hope for patients. It's just making sure that right now, all the challenges that everybody's living with this condition, they try and get as much support and help from everybody that they can by raising awareness.
My grateful thanks to Stephanie Smith from Dravet Syndrome UK. To learn more and to connect through to the charity, visit the wordonhealth.com website. That's wordonhealth.com.
Keeping you in touch with the health and lifestyle issues that matter. This is Word on Health with Paul Pennington.